Good evening, I'm Nicole Carrico. I'm going to talk to you today about the stresses of nursing. Nursing stress. More support for nurses will provide better patient care and make nurses happy. I think that we're a little bit overloaded in the hospitals and the healthcare facilities. Nurses have many stressors in their workplace, such as death, lack of support, and equipment. All of the above are negatively impacting service to patients. Creating less stress in the workplace will positively impact service to patients and decrease the nursing shortage. The proposition is that we want to increase the enrollment in the schools. We want to provide coping strategies for nurses because they're under a lot of stress, so they need proper care. We need to limit the work overload and offer more incentives and or bonuses at the job place. There's a huge shortage in this field, like I said before. It's very difficult to get enrolled in any nursing school around, as you may know. Nurses have no coping mechanisms to help cope with death. Nurses cannot provide good patient care due to all of the above. This is the nurse dissatisfaction percentages. As you see, the staff nurse, nurse clinician, supervisor, home health nurse, and so on. The job dissatisfaction rates are very, very high, all ranging within 15%. And this is from www.netce.com. We need to improve the nurses' dissatisfaction and make them happy. Corporate training to improve the management would help. Increase teamwork, effort, hire within, so people know what they're doing. Corporate funded education programs. Increase wages, use of electronic medical records, which some hospitals are already doing that. This is the shortage of nurses currently. This is actually from 2010, and this is from the Bureau of Health Professions, RN Supply and Demand Projections. This is our demand, and this is our supply. As you can see, it's very, very low, and we need to increase the nurses, or we're not going to have any help in the hospitals or healthcare. Decreasing the shortage, we can increase financial aid limits, state and government incentives for enrollment, increase wages for current nurses, and reduce staff turnover. This is student enrollment. Like I said before, it's very hard to get enrolled into the nursing program. It's basically eligibility versus availability. We're just so overloaded that we don't have, enough people actually to get the students in and get them moving on to becoming nurses. As you can see, associate's degree, the people that graduated, which are eligible applications, and then you see the people that actually have available seats. You can see that everyone is eligible, but if you look over here, there's not enough seats available to get the nurses in. And this is from source www.lao.ca.gov. We need to improve the availability, build more schools, hire more nursing instructors, increase class sizes. So I'm going to conclude as it can be concluded that nurses are faced with many stressors in the workplace, such as death, lack of support and equipment, which negatively impact their delivery to patients and their overall job satisfaction. The current shortage of nurses needs to be looked at critically in order to reduce these stressors that face nurses today. Therefore, it is the best time to volunteer at your local healthcare facilities and or consider becoming a nurse so we can decrease the nursing shortage and help people the right way. Thank you.